People in their 30s can't have facelifts. Well, that's false. And in this documentary style video, you're going to meet a patient in her 30s who underwent an endoscopic brow lift, endoscopic central facelift, and endoscopic neck lift with all her scars hidden behind her ear and in her hair. And what you're going to learn is that this is a procedure that is available for people in their 30s, 40s, and 50s potentially. There's a lot of wonderful applications for it. You're going to meet her, you're going to see her process, and I think it's going to be very inspiring.
My overall goal is to look refreshed, awake, and hot. I feel beautiful. I am 35 years old, about to be 36, and over 3 years I lost 55 pounds. Initially, when I had talked to Dr. Weinfeld, we had discussed a primary deep plane facelift. And I was excited to have that, but I eventually spoke with him some more, and he discussed an endoscopic approach with less incisions, and that definitely helped me make my decision to move forward with my procedure. I do work in healthcare, and we're constantly on our iPads, so I think there's something called tech neck, and that's causing these wrinkles right here, and I really hate them. I feel like they show my age. I would really love for my crow's feet to be addressed if possible. I do feel like they show aging as well. Whenever I look in the mirror after some weight loss and just getting older, I just feel like I have some excess skin and volume loss. I've noticed fillers aren't really doing their job with lifting anymore, and yeah, it's my main concern. So I feel like I'm holding my eyebrows up a lot to make myself look more awake. I definitely feel like my lids are a little bit heavier, so I'm also doing my makeup a little bit differently to make myself look awake. So with weight loss and just general aging, I feel like I've lost a lot of volume in my cheeks. Like I said, filler hasn't been doing its job anymore. I definitely feel like my lips have gotten significantly thinner, and whenever I smile, these lines right here have gotten significantly deeper. I've also noticed that my jawline isn't necessarily defined as it used to be. When looking from the side, there's not a definition, there's kind of like a swoop more than actual pointed angles, and that really bothers me in photos. I feel like with the weight loss is where I noticed a lot more skin laxity right here, especially since I lost actual fat here. There was just skin, left over. So as far as volume in my face, I would prefer not to have a rounded looking face. I would prefer to have a more like inverted triangle. My fear is that even when I was larger, before I lost all the weight, my face is really round, and I feel like it made me look puffy, and I really didn't like that look. I am excited to have a procedure that addresses my face shape as well as my face overall. I'm excited to look refreshed and sharp.
So, Peyton, first of all, once again, how old are you?
I'm 35, about to be 36.
Yeah, and we're going to be doing an endoscopic face and neck lift, brow lift, upper lid blepharoplasty, and buccal fat pad reduction. And all of that was to address some facial aging changes that you observed that occurred obviously with age, but also you had lost a fair amount of weight. Just tell us, kind of briefly, what was it that you had noticed that motivated you to have surgery?
The biggest motivator for me was going to be the jowling after weight loss, because I just had a lot of volume loss. I don't know if you've been on a GLP before, but sometimes that can happen.
So one of the things that bothered you is you felt like you were starting to look tired as well, like more so in the past?
Yes, I definitely feel like I look exhausted a lot of the times, and I'm constantly kind of like holding my eyebrows up to make me look more awake. Botox isn't really helping in that regards too much anymore as well.
Let's take a look at your face, and we'll kind of discuss some of the features that you identified as target areas that you want improvement. So we have the eyebrows that have slid down. They're also flat, which is not necessarily feminine. They contribute to the excess skin that you have in the upper eyelids. When we look at the midface, we really see the typical changes that we see with weight loss and with aging, and aging that can occur as early as our mid-30s, where we see the cheek sliding down the face. It slides down and it bunches and crowds the middle part of the face. That's how you get the deep nasolabial crease with a heavy nasolabial fold. you get this hollowness here because the cheek tissue has slid off the bone. And then also the jowl. Many people don't necessarily realize this, but the jowl really is the lower part of the cheek that has slid over the jawline. And in addition, we see that you don't really have a sharp angle to your neck anymore. You have this rounded area here. So these are going to be the areas that we're going to target with our procedure. Okay, so we're going to be doing an endoscopic face and neck lift. And what's important to highlight here is that an endoscope is a camera on the end of the stick. So for a patient who's young, such as you, and you're 35, you don't have a lot of excess skin. There's not a lot of excess skin crowding in your face, but we can see those early signs of facial aging that were compounded by that really impressive weight loss that you were able to bring about. And so you are definitely going to benefit from everything that you can benefit from a face and a neck lift, but with hidden scars that are hidden within the scalp and behind the ear, even perhaps a small one underneath the chin there. So a really powerful procedure. It's ideal for someone your age, for someone, again, who sees the facial aging in the front, but they don't have as much on the side. So it's a really wonderful procedure.
So we're here, the big day. We're going to be doing our hidden scar endoscopic Trimax deep plane facelift, upper facelift, and neck lift, in addition to some other procedures. I'm going to go over the markings. I'm not going to speak directly to the camera here for this because I need to focus on her face, but I will give you some details as to what we're doing as we go along. So here we go. All right, so first of all, I need you to smile for me. All right, and with this, I'm marking out one of the most important things, which is the muscle, the biggest smile muscle. Okay, you can unsmile for a second, and then do it again just to make sure. And then unsmile, and smile again. All right, we got that. Okay, now, yesterday we were able to identify where your nerve came across. We did that. So this is the nerve that moves the forehead. Felt a little tenderness. Do we still feel it there?
No.
Oh, right here. I'm sorry, right here?
Yes.
Okay, yeah. That's about where it should be. Expect it to be there. And we know that it goes just above the eyebrow. So this is the biggest part of the surgery, is avoiding that nerve. All right. This side, I think, was the side where, this was the side we actually felt it more, maybe? Or I can't remember.
Higher.
Well, it's got to come across somewhere. Let's see here.
Right there. So,
Oh, right here? Yeah.
Yeah.
That's about where it was on the other side. And also, by the way, it's where the mark was. Still present. Okay. All right, so those are some of the most important things. Let's go ahead and get another marker color. All right, now let's bite down. We're gonna mark that big chewing muscle. That's how we separate our entry points. Okay. Do the same thing on this side. I can still see it, but yeah, go ahead and bite down. That helps me know exactly where that muscle is. All right, now, it's fun dodging the, all right, now, so we need to design our flap, the deep plane flap, in a way that helps us avoid that nerve. This is where we have to be the utmost careful, is right over here. Going to come a little bit further inferior where it's much deeper, even though it looks like we're overlapping. Now, push against my, okay, that's good. Yeah, nothing's changed there. This is the edge of the sternocleidomastoid, some important anatomy there, plus we're going to get some strong tissue called fascia from just over that muscle, and that's going to help us. That's going to help us really secure and lift the neck portion of this procedure, of your anatomy. All right, go ahead and push against me again. Okay. All right, now let's design this here. I'm going to head south a little bit.
here to keep it super safe. This is where it's a little bit deeper. And then this is where it comes up just a little bit to get a little bit of it. Finish up and then across here. Okay, now a couple of things. We're going to do my subtraction, addition portion of the procedure. This is really describing the release and repositioning. That's moving the tissue upwards by releasing the ligaments. Now we're going to do subtraction. We're going to remove any of that residual jowl. And then addition, so that decreases the width of the lower face. We're going to need a little bit extra volume along here, not too much. She's got good solid cheekbones, but we can only supplement it a little bit. We're also going to be adding a little bit to the temple, and we'll talk about that in the actual surgery. And then on this side here, subtraction, addition. You can see where that hollow spot is there. Temple also. Okay, now we need to augment her chin just a little bit. That's going to help strengthen the distinct nature of her jawline. So we're going to add just a little bit of fat here. We talked about adding some collagen in the form of rib cartilage, but we decided for a softer look, we could always come back and do that later if needed without her going to sleep. I think we're going to have a little bit of fat to address there in the neck, both above, more below the platysma than above it. Go ahead and give me that. Ooh. There we go. You know, yesterday I had a little hard time seeing the inner edge of that. I think you're just stronger there, and then we got this here. Dude, give me real strong again. I think it's tired. Okay, and along there. All right, that's good. You're good. Okay, and then we need what I need to write here is a little bit of a platysmal back cut there, a little bit of a platysmal back cut here. We'll measure them in the operating room. Okay, and then we'll likely do a very small platysmal back cut. This one here is going to be a little bit higher. That little notch there that helps reduce the banding there. Now, she has very small submandibular glands, but they go a little bit low, so we're gonna likely reduce a little bit of that. We'll talk about that in a second. You and I will. All right, now I just put a couple of dots to remind me that we're gonna add some fat to the lips. And then the final thing is we're gonna be doing upper lid blepharoplasty. The markings for that I'm not gonna really show because it's not the total emphasis of what we're talking about here, but they're very simple markings. Now, let me take a look and just think for a second if I have missed anything that is important. So one final thing I actually want to do is I'm going to feel where a particular vessel comes across the jawline. It helps us identify an important nerve, one of the smiling nerves. Do you feel the same thing? Any tenderness?
Right there.
Right
yeah.
there? Okay. All right, so that's likely, and that makes anatomic sense. So that's just going to remind us that that's there. And then let's do the same thing here. Feel anything? I feel like this side you don't feel stuff as much. I wonder if it's just always the second side.
A little bit right there.
Right there, yeah. I actually felt it roll underneath my finger.
Yeah.
I was just waiting to see if you had anything that you'd kind of experienced there. Okay, now let's go to a different color here because we want to outline the extent of our deep dissection. Strong today. All right, so this is going to be our subcutaneous dissection, but this is all under the endoscope. Okay, and then the final thing that I forgot to do, but we will not forget to do surgically, is a little bit of micro liposuction. We did this yesterday, but a little micro liposuction here. That's gonna help us as well. So I'm gonna, when I can look down on you, I'm gonna make the markings for the upper part of this. We already have the incisions marked for how I'm gonna access the face from just above your ear And then the brow lift will have a marking up here and here, which I'm going to do when I can kind of look down on her when she's at the table. So, any questions?
No.
All right, she's back there in the operating room going to sleep. I'm out here scrubbing in. I'm going to be going in there just a minute, and transformation starts then. All right, we just finished. Everything went very, very well. I think she's going to be extremely pleased with the results. Here we are 3 months after our hidden scar facelift. What did the hidden scar facelift mean for our patient here in their mid-30s? What that means is that we got the full advantage of a brow lift, so an upper facelift, a facelift, central facelift, and a neck lift. All of them deep plane procedures, but all done with hidden scars. Let's talk about where her incisions were. She had a small incision here, small incision here, one here, and one behind the ear. Through that, we were able to do the forehead, the central face, and the neck. To complete the neck, small incision beneath here. So, if you look at all of those and you think about it, it ends up being a hidden scar facelift. You can't see any of those incisions. Nothing in front of the ear, as we would do with a traditional facelift. We don't even have incisions that go around behind into the hair, as you would do for a traditional neck lift. These are all deep plane procedures. They're all procedures that we use an endoscope for. An endoscope is essentially a camera at the end of a stick. We stick that camera in through the small incisions, and through those small incisions with the camera, we're able to see tissue, we're able to release, reposition, and secure it in a more youthful, more shaped position. Now, let's talk a little bit about the results that we achieved. We've elevated the brow with the brow lift. We've created a more crisp upper eyelid crease with the brow lift, but also with that upper lid blepharoplasty. With the facelift, we've elevated and supported the cheek, and with the facelift and the neck lift, we've created a more contoured, more visible jawline, a more athletic appearance, a more awake appearance, a more youthful appearance. It's all about shape. This is shape surgery because we're not removing any excess skin. We're really just repositioning all that good, healthy tissue into a more youthful, a more shaped location. The key to this procedure is that we're able to do everything we can do in a traditional deep plane facelift, but we do it through small incisions with that camera, that endoscope, that camera on the end of a stick. And I want to just give you a sense for that. So for example, we had an incision here and an incision here. Through that incision, I was able to elevate the skin, address the deeper tissues, elevate and secure them to firmer tissues further back underneath the scalp. Okay, so it's very similar to what we do with a full deep plane facelift. It's just done without visible scars on the front of the face. It's important for patients to understand that the whole process of facial rejuvenation doesn't begin with, and it certainly doesn't end with surgery. It doesn't end with a facelift. And there are maintenance things that need to be done, maintenance procedures, maintenance upkeep. And Peyton happens to be not just a patient of ours, but she also works with us. She's very well versed with it, so I'm going to flip this back to her.
So what we typically recommend, and what I have done, is definitely continue to use my retinol. Definitely having good skincare is super important to keep up with that. I also did the Aveva laser. That also is adding, some additional collagen support. It's going to tighten my skin some more. It also resurfaces. It's definitely something I plan to do every year just to keep up my wonderful results.
Yeah, and that's actually a really important thing to mention. And that is that clearly she's a younger person. She's had a facelift, but really with very little downtime and no visible scars at an early age. She's doing the kind of things that she needs to do to maintain those results. However, the reality of it is that she may get to the point that a little bit later in life where she may want to have a facelift again. Now, technologies may be different at that point, but let's suppose that happened now. Not to her, but like to a person like her who's older. So they've had an endoscopic facelift, they've had a hidden scar facelift, but they've reached that time where tissue has really sunk down and now they have excess skin. That's when we can employ the techniques of a traditional face and neck lift, and we can do it, and nothing that she has done will prohibit her from having a full open facelift with full scars in the future.
How you're feeling since you had your surgery?
I feel great. I feel like everything is really settled really naturally. Super happy about my chin and my neck. Looks amazing. Everything's just honestly pretty perfect. I look like a new person in the best way. As far as recovery goes, pain, was very minimal to start with. I did have a little mild discomfort on my cheek for a little bit longer after surgery, but it's since resolved. I do work in aesthetics, so as a patient, I did understand that along the way, it is a recovery. There's going to be a little lump and a little bump every now and again, but after talking with Dr. Weinfeld, he is always making sure I'm taken care of as a patient, and I'm happy with my results. As far as my lips that I was talking about before, they needed a little extra plump, and we put some more lipoderma in them, and it's these little details that Dr. Weinfeld really pays attention to. I definitely feel way more awake. My eyelids don't feel so heavy anymore. You can see my eye makeup whenever I wear it, which is really nice. So I was getting some pretty good creasing up here, so that's nice. I can show off my skills a little bit more. I also have found that my mascara on the bottom, it doesn't run so much. I'm guessing just from my cheek being repositioned a little bit differently, so that's really nice too. Another thing that I was really self-conscious about was my lips. They were pretty deflated. It, honestly, one of my biggest insecurities, I will say, so I'm really happy with the shape of my lips, the volume of my lips. They look great. They look great in lipstick. Makes me really happy. Something that surprised me in a good way was how fast I was able to get back into life. It was really nice being able to get back to work and moving around and going about town without being in pain or worried about being in pain. That was really great. I returned to work on week 2. I was working from home doing patient concerns and triage, and I was back in clinic at week 3. The first time I went out with friends was 3 weeks after surgery. We went out for South by Southwest. I felt like my face was my face at around a month and a half again. The swelling had gone down, that pain that I was talking about in my cheek had resolved, and my makeup was sitting great, I looked great, and I felt great. At first, I will say, it's like typical of a facelift patient. I did wear a hat and sunglasses, at about week 3, but after that, I lost the sunglasses, lost the hat. It was definitely earlier than 3 months. I would say definitely take it slow. If you work in a clinic or you work on your feet, definitely break up your day. Make sure you have some time to sit down because you are going to get a little tired at first. I would say things started improving as far as my energy around 2.5 weeks or so. My favorite part of my results are definitely my jawline, my neck, and just looking more awake. It's great. Definitely people are looking at my eyes a lot more. I've had people tell me that they're sparkly or that I have, doe eyes.
And how does your husband feel about the whole process?
At about week 3, he was like, babe, you look great. He was like, you made a really good decision for yourself. He's wonderful. He always just wants me to be my best, happy self. And, he's great for that. Having good support is important. So at the beginning of this, I definitely said that I wanted to look more awake, I wanted to look snatched, and I wanted to look hotter. And I do feel all 3 of those things.